Welcome, friends. I have been waiting for Dr. Borger to come along in my life and be a guest on my podcast. Dr. Judith Borger is here. She is board certified in emergency medicine, but we're here today to talk about aesthetic medicine, which is what she's been doing for at least the last 6 years. Dr. Borger, thank you so much for being here. Welcome to the show.
Thank you so much for having me. I'm so excited.
You are a podcaster also, and you have your own podcast about aesthetic medicine. And so we're here today to talk all things non-surgical aesthetics, which means what? Describe what it is that you specialize in and what your practice does.
Yeah, so that's the way I kind of describe it, that I do everything that you need a needle or a laser for and not a scalpel. So, of course, I do a lot of injectables. I do Botox, I do filler, but then in my practice, we do a lot of IPL for sunspots, reds. I treat veins. We do laser hair removal. We do frax laser. We do RF microneedling. We do PRP, and if I haven't mentioned it, we probably do it. But if it's something that requires an OR, like a tummy tuck or a facelift, we don't do that.
Gotcha. But as I mentioned, you are an emergency medicine physician. So how did that work out that you started a career in EM and you ended up as an aesthetic medicine practitioner? And do you still practice EM?
I do still practice EM. I practice EM because I love it. I actually do pediatric emergency medicine, even though I'm EM boarded. I really believe that, and I'm hoping this resonates with your listeners, that we create the life that we want. And I'm a big believer in really job crafting and really things being flexible and fluid and always following your passion. I had a big interest in dermatology and I did a rotation in med school. And you know how rotations kind of really sort of determine on where we go. And I did a regular dermatology clinic and I was rash prescription. I was like, oh my gosh, I can't do that for the rest of my life. And I love how, and I'm sure in family practice for you, it's the same. Emergency medicine, you get to help all sorts of people. You're kind of the person that is the most useful in any situation. I mean, you're maybe not the specialist, but you're super useful in a lot of situations. And I just love the variety of it. At the same time, I always had a love for aesthetics. And a couple years after, 5-6 years after being done with my residency and I was practicing and I felt like I had a good grip of emergency medicine, I had always taken sort of aesthetic courses, learned more. I decided to really let that right brain side of my brain and the creative side of my brain also come out. So I started building a practice that is a concierge practice. It's a boutique practice. It's growing. I have now the podcast, but it's really a passion of mine. I love the beauty aspect of it. I love the way I can connect with mostly women. Just like I love being there in people's life-threatening situations. It's just different ways that fulfill different aspects of my personality. So I guess my lesson from all of this is, and especially for either younger physician or anybody else listening, you're never pigeonholed. You can always make everything what you want to make it.
I love that theme. And it is certainly a thread that runs through, nearly every episode that we've had. I speak mostly with multi-passionate women physicians who are high achievers, who don't want to be stuck in one box for the rest of their lives. My father's generation, who was, the generation that kind of inspired me to go into medicine, their Monday to Friday, every other weekend, every other night call, their career as a physician is their entire life. And aside from a couple of hobbies outside of that, that is their whole life. And our generation, you and I kind of went to school in a different time where we kind of were encouraged to become entrepreneurs, learn a different side of medicine, use your skills, use what we've learned to teach or go into research or consult or explore other specialties that your skills and interests, would benefit from. And so I love that you bring that up first and foremost, and it kind of ties in with the whole concept of what aesthetic medicine is and how it can help enhance your life. It is not a cure for, the things that are really wrong in your life or the things that are bothering you in your life, you need to, whether it's related to your appearance, your self-confidence, your career, your relationships, become whole from the inside out. Do what you want, create the life, the career, the appearance that you want to for you. And I love that. I love that. That's how we're starting this conversation.
Yeah, and I couldn't agree more with what you said, because health has so many dimensions,
Yeah.
and your physical appearance is definitely one of them, because like you said, it feeds into your confidence. It
Yeah.
feeds how you show up in the world. It feeds into your self-image, and only what you imagine is possible, right? And so like there's spiritual health and mental health, and there's definitely physical health and appearance and how we show up in the world in all of our aspects.
Yeah. And there's so much in the beauty industry, that's non-invasive, non-surgical. And I've just now, as I'm into my 40s, getting more interested or learning more by necessity about, makeup and, different approaches there. And it's just really interesting to see how, as I've gotten older, the emphasis has been different, like in your younger years, it's on the clothes that you're wearing or whatever, and now as I'm getting older, it's like, what hairstyle is going to complement not just how I look and help show off my, my best self, my best assets, a look that makes me confident, but, what kind of hairstyles, what kind of makeup, what kind of aesthetic procedures and things like that, whether it's non-invasive or invasive, how do I want to exercise and how do I want to project myself to the world? And that's
Yeah.
changed over the years. It's really interesting.
And I find that I'm in my 40s as well, is that I'm so much more connected to my body than I ever was. And again, having that confidence and that groundedness, you make such different decisions.
Yeah.
And it's kind of wonderful. I totally think that my 40s have been my best decade yet.
Yeah, I think I agree with you. I think, I've had fun in the 20s were kind of a blur because I was in school like you, but
All of us were.
But as your priorities change, you're right. I think this is the decade, or this is the time, for the first time in my life, where I really am starting to think about who I am and what I want and how I want my life, not only my life, but like my everyday to go. And that relates to everything: hobbies, relationships, career, contract. Like, I'm not afraid anymore. You know what I mean? I'm not afraid to take the bull by the horns and advocate for myself.
Yeah, absolutely. I mean, that's how I feel. It's just a different sense of freedom. And I've heard from a lot of people that are in the 50s that it just keeps going. So I'm really looking forward to that. Contrary to what everybody says, is that women are afraid of being older, but I think we're aging well. And just this, like, knowing who you are, I think, is different, and knowing what you want and being very okay with what you want and supporting yourself. I mean, I think that's really the biggest difference too, that I don't care as much about what other people think. I have my back.
Yeah. Yeah. And you have a lot of other people who have your back too. I think it's such a badass and beautiful way to start the conversation. And I'm glad that that's how we got off. But I do want to talk about aesthetics, because we are in the technological era, the information era, where there's so much noise out there, especially when it comes to appearance, especially when it comes to fashion and skincare and procedures related to aesthetic medicine, surgeries, things like that. There's a lot of information that's out there, which can make it very difficult to know which information is reliable. And so the first thing that I want to ask you is, if someone is considering any kind of injectables, you're at the nail salon and the woman next to you says, "Oh, I got Botox," or "Oh, I had this peel," or this, laser resurfacing of whatever. And it piques this woman's interest and she has not explored it at all. Where is a good place for this woman to start investigating how she should go about learning and potentially becoming a patient of someone who does injectable aesthetic medicine?
Yeah. And just to throw that out there, and then I'm going to answer your full question, but that's exactly why I started my podcast, The Aesthetic Doctor, because just like you said it beautifully. There's so much noise out there. And my podcast is really about kind of boiling down the truth about all things aesthetics, as the tagline, for the end consumer. Having somebody sort of like, imagine me as your best friend that you can just call up like my friends do, and they're like, hey, I'm in Omaha, but I'm thinking about X, Y, and Z. What do you think about it? Tell me more about it. So that's the premise of the podcast, is having a best friend that's a doctor that has no financial interest, that has nothing to gain or lose, that really just wants you to have the best treatment. In terms of finding a provider, I mean, of course, my preference would always be that you go seek out a physician, because our training, as you know, is long. And even if it's cross-trained from another specialty, I think, at least with me, I didn't just take one Botox course and started injecting. I did a couple years of courses and then started injecting. And then also like talk to their patients if you know anybody. I mean, personal recommendation is great. And then don't go bargain shopping. Like, a lot of things like Groupon Botox is not what you want to get. You want to go into somebody's office, and first of all, you want to feel good about their credentials, the way they have their consult. Again, stand up for yourself. If you feel like you're getting rushed into something, or they're not willing to explain things to you, walk out the door. You're a paying customer. Like, this is not, you don't have to be there. So I think training is really important, but then, unfortunately, the aesthetic industry isn't really well regulated. So it's really up to the individual provider how much they keep educating themselves, how much do they keep up with the research, how much are they on top of the aesthetic game. Social media now is a great place to check out somebody's before and afters and what aesthetic they're going for, but then also realize that social media can be filtered. Social media has its own problems. So it's not the only thing I would go by, but I think it's kind of a combination between, hopefully, if you know somebody, you get a meet and greet with that person to make sure they're actually listening to you. You love their overall aesthetic, and then that they're well trained. So I would always recommend that patients go seek a physician.
Yeah. You brought up a couple of great points. I don't know if you know this, but I am trained in aesthetic medicine as well. I, as a family physician with a practice, kind of came into it by necessity. Patients were asking for it. There was actually a colleague who wanted me to join in an aesthetic medicine venture that ended up not coming to fruition, but nonetheless, in the meantime, I got trained, and I would do injectables for my patients. I didn't have an injectables practice, but or an aesthetic medicine practice, but I did, inject Botox and fillers for my patients when they asked for it, because they would say, oh, hey, do you know anybody who's trustworthy where I can go? And I would say, oh, hey, I do it. So I know a lot about the training in the background. And as you were speaking, I was thinking of a couple of things. When you mentioned how you think that people should seek out physicians, the one most important thing that I would tell people the reason that I felt they should seek out physicians, or at least somebody who has the highest level of training, is not necessarily for the aesthetic, but so that they know how to manage the complications. Because aesthetic medicine is not without risk, and it is not without complications. It is generally safe, but bad things happen in every field of medicine. And anytime you cut skin, inject anything that's a foreign substance, you can have a reaction. And so it is of utmost importance that you go to someone who is skilled, trained, and prepared with all the proper equipment to handle an emergency or a complication related to an aesthetic procedure.
You are absolutely right. And I've heard horror stories from nurses that I've talked to, from patients. And I don't mean nurses, just like nurses at work, like, right? We're like, oh, wow, they told me that if something goes wrong with the filler, we'd have to rush them to the ear. I was like, what? You're getting injected by somebody who doesn't even have an emergency kit or a reverser or something? Like, really? But so you're absolutely right. I think as physicians, we're uniquely qualified to not only kind of risk assess the procedure and also like evaluate patients' comorbidities, because sometimes it's not only just about the Botox or the filler. It's like, if you come to me with an autoimmune disease, or you come to me on anticoagulation, I think as my background and all my other training, I can then be like, okay, yeah, let's not stop this medicine because the risk benefit is really not here. Or, you know what, this is probably okay. And I think that is maybe something that people don't think about, how we can evaluate the whole picture instead of just injecting the Botox.
Right. And that, in the same vein, when you arrive at a facility that is injecting, you mentioned the Groupon, you're going to get what you pay for in terms of, anybody who's advertising a special. I also advise highly against shopping, for a bargain when it comes to injecting your face or having a procedure on your body of any sort. But if you arrive in a clinic or an office where there's 15 patients lined up and, they're walking in and out and it's just injections and there's no real consult or there's no real conversation or history, there's no discussion about what are your goals. Every single injection is different depending on what that patient's goals are. You're not just putting the same amount in the same points. You see what I mean? And so if you recognize that you're in a practice
like a mill,
like a mill,
Botox
where
mill,
patient after patient, and that's definitely a red flag that maybe you want to consider going somewhere else.
absolutely. And I, like you, I have a boutique practice, like I said, and so we really pride ourselves on knowing our patients and B, really the art of the consult, because my goal is to bring out the best you. And what I normally start with, my opening line after the hellos, is sort of like, tell me the story about your face. And I just listen and I just wait and see what comes up.
Yeah. And, sometimes you probably experienced the same thing. We walk around looking at bodies. I mean, I'm an osteopath, so I'm always looking at people's posture and, and then when you get into aesthetic medicine, you walk around because we're trained to assess, kind of looking at different facial structures, men versus women, older skin versus younger skin. And so when you're looking at and making the assessment, you really do want someone who is going to enhance what you have naturally, not take away anything from you, not make you look like a different person.
Yeah, enhance your best feature, like be you in whatever best way today we can show up, right?
And I would ask people, like, what are your goals? Because I know standing there looking at you, what I think would work best or what would look best. But it would happen often where somebody would be like, come in and say, my marionette lines are the lines around my mouth are what's worrying me. And that was like the last thing I noticed on their face. I noticed their crow's feet wrinkles or their forehead, and they were not at all bothered by their crow's feet or their forehead wrinkles. All they saw and all they cared about was those marionette lines. So it's
so true. It's so true. You don't know what people's insecurities are. Like you can guess, but once in a while, I have had that same thing where, what are we here to talk about? And you could swear it's that deep, dark frown. And they're like, that one spot right here, do you see it? And you're like, not really, but sure, we can laser it away.
Exactly. Another great piece of advice that another colleague gave to me was that a good injector, a good physician who is going to provide you an honest assessment of what you need will tell you when you don't need injections.
Yes. And I tell people no all the time, or, a lot of times, because like you said in the beginning, they will have seen the person at the nail salon that they got in a conversation with, and they'd be like, oh, their face looked really good. They got this peel, and they're coming in and they say, I want this peel. And I feel like my responsibility is to tell them what's going to get them the outcome that they want, and to really give them the outcome driven medicine. Because I think, especially with social media, it's one of those downsides. They see one of the Kardashians or whoever, and they're just seeing that one procedure they got paid for to show off, and they're going to be like, but I want this one filler in the jawline. And of course, they've had 300,000 other procedures done, but secondarily, I always linken it to kind of like, if you just tried on your friend's bra, it's not like, you can't just take what worked for somebody else's face and have it give you the same outcome. So, maybe that person's skin is glowing because they had a peel, because they really had textural irregularities before. So yes, for them, a peel is the right choice. But if you're bothered by the veins on your face, you might need a YAG laser. If you're bothered by your browns, you might need an IPL, and that is going to give you that same, or head you towards that same glowing, even skin that maybe your friend needed a peel for, or vice versa.
Yeah, and that's kind of where the dangers of social media and getting other people's experiences, overall, if someone had a good experience with a particular injector or, physician, then that's a great recommendation. But when someone comes in and says, I want this specifically, sometimes it's hard for us to say no or to convince them, because you want them to be happy, but to make them happy and to give them what they're looking for, it comes down to the fact that this is a very customized, individualized consultation where we're assessing you as an individual, not you and all of your social media, those people that you follow on social media.
Yeah. But I think that's also where education really comes in,
Yeah.
right? Where it's our job to not just say, no, this isn't for you, but really tell them, like, look, your skin is a Fitzpatrick 5, meaning you're Indian. Like, I really can't do an IPL on you, but you know what? We have this wonderful melasma peel and we can do a frax, and that's really safe on your skin. And so I think, again, like we said, that's where the consult comes in, where we really talk. And we also establish, when I say authority, I don't mean it in an authoritarian kind of way that we badger them, but where we kind of use our education and our training to really give them the information that maybe that social media reel didn't give them, to say, hey, look, like, this procedure that your friend has is for X, Y, and Z. Is X, Y, and Z your problem? And most of the time, it's very easy for them to be like, well, no,
Yeah.
and you can be like, well, if your problem is, this, if today we're talking about your forehead wrinkles, like, that's going to be Botox all day long.
Right. And just in terms, again, of finding a physician who's a good fit for you, if you're presenting yourself to someone for a particular issue and they're trying to sell you on every single thing that they have, it's probably best to at least get a second opinion from someone else. I also would always talk to my patients about, budget, because it can
Yes.
add up. And to get the results that some people are looking for, it's not just one syringe. Or for example, you can spend a whole bunch of money injecting your neck over and over every 3, 6, 9 months, or you can spend money once for a surgical neck lift and have more permanent results. So someone who is honest with you is going to give you all of your options and not just say, oh yes, you need all of this every 3 months. And if you go in for Botox, you're not also getting the entire kitchen sink. You know what I mean?
Yeah, and you're absolutely right. I think you found a really good injector. I think the first time they tell you no, when you are willing to spend the money and you come in and you're like, I want this big procedure. And they're like, you know what, let's try this first, because I think that's going to work for you. And I always tell my patients that this is a journey. It's a journey to your skin. And yes, I try to fit into somebody's budget, but sometimes I have to be honest also and kind of say, hey, look, if you just get one syringe with the degree of volume loss that you have, you're not going to be happy. So why don't you, save your money? And when you're ready to buy 2 or 3 syringes, we'll do the full correction, because right now, one syringe is sort of like a magic drop into like a sink that will just kind of like suck it up.
Yeah. And your patient's going to end up disappointed. You're both going to end up frustrated, and the overall experience is not going to be a positive one if that's the case. I always say with fillers and Botox, especially, you can always add, you can always adjust. You should inject, I would always recommend going for as natural an appearance, because you'll get people who come in and say, I want to look like I just came out of a wind tunnel. I don't want any movement, or I don't. And that they're not going to be happy with that result, because not many people are, and so setting the expectation, figuring out what kind of look this person wants and what is the stepwise approach, inject a little bit and build up over time, come back in a few weeks for reassessment, do it all in once, that's a conversation. It's not like McDonald's where you go in and order up your, 50 units of Botox and that's it.
Yeah. And also, I mean, I guess there is training, and let's say we have 2 injectors that have the same superior training, there is still an art involved.
Yeah.
And sort of like finding your hairdresser, because there's that, especially like we said, I really analyze people's forehead movement, and I do a lot of lips. I'm sort of getting known for lips. And so lips especially, there's different shapes and there's different aesthetics. So once in a while, you will also go to somebody and their qualifications are amazing. And you and them might just not agree on the same aesthetic goal. And that's okay because not everybody is for everybody.
Right.
So, I would really encourage your listeners or anybody to find somebody that they feel like listens to them, to find somebody who they feel like hears them, and then to find somebody whose aesthetics goals vibe with theirs. And then also, I mean, the other thing is that, the more tools I have in my aesthetics practice, the more things I can address. So, of course, if somebody has less tools, they might, only have less tools. So once in a while, you do need to go to somebody with more devices. But even now, because I don't do surgery, I refer people for blepharoplasties or eyelid lifts all the time because I tell them, hey, filler's not going to do this. Like, this is a wonderful person, XYZ, who does great blepharoplasties,
Yeah.
or like you said, neck lifts. Like this is beyond what my RF microneedling can do.
Sure. Yeah. And that's when you've got somebody trustworthy when they say, this is out of my, scope, or this is, I don't, as much as I can do, you're still not going to get the result that you want. And so, we can refer you somewhere else. How do you manage expectations? Because some people come in expecting a lot out of Botox and fillers because they see it on people who are spending tens of thousands of dollars in, surgery and, say, oh, I just had a little Botox, so you probably have a lot of patients come in with very high expectations about what injectables can accomplish. How do you manage those expectations?
It's an interesting point that you bring up. I haven't found that as much with injectables, I think. And again, I'm just pretty straightforward and pretty honest and kind of tell them like, look, this is laxity and this is volume loss. I find it more with other things like the RF microneedlings, or we have a new device, the Texel, that does tightening that people, suddenly expect to come out of a hour or 2 hour procedure and, look like there's somebody completely different. And we took away, not only 10 years of aging, which I think we can do, but, make them look like their 25-year-old daughter, which is really not going to happen. But I think it's really like taking pictures too. People surprisingly forget what they looked like because they see themselves every time. And, we always take pictures and we have them also see their picture and look at their picture, maybe a little more objectively, and be like, where do you think you would like to address this? But then they see the before and after and they're like, oh, wow, that's a huge difference. When, we get so focused on, I still have that tiny little line. And you're like, wow, but there's a tiny little line when there used to be a huge crater of a line.
Yeah. That's also, you bring up a great point, again, kind of referring back to our first point about finding a practitioner. You always want to have someone who's going to ask you to follow up, because so many of the procedures that you are capable of performing and you do so on an everyday basis, the results, some of them you can see results immediately, like before.
Yeah, that's why we love filler, because everybody walks out. But even Botox takes a while to set in, more with the skin tightening procedures or the peels, or even, when we do a series of microneedling, because collagen stimulation over time takes time, PRP. Yeah.
So you want somebody who's going to ask you to follow up, not just necessarily inject and say, sayonara, thank you for all the money that you just spent.
And of course, what we also got to say, which should go without saying, but because we're having this conversation, you should never have any worries about sterility or cleanliness. I mean, I feel like that's a whole different, level of bad that we shouldn't be able to say. But, when you read a lot of the horror stories of things gone bad, it's like, to you and I, those stories are like, oh, I met somebody in a hotel room and, they were reusing a syringe. Like, things should always be super clean. You should always use approved product. You should always use sterile syringes, clean, you do gloves. So I just wanted to make sure that as we're having this conversation, we're mentioning that, because that should go without saying. But if you notice any of those things, like, run, don't walk, run.
Yeah. And unfortunately, they do happen in this country. Like you said, it is not as tightly regulated an industry as other fields within medicine. And so you can have people who are practicing aesthetic medicine who are trained, either are not trained or who are trained, to a lesser standard than a physician would be. It's a great point. It's a great point. And I'm glad you brought it up. I want to just address, kind of give people an overview. So for anybody who's listening, so let's say I'm the lady at the nail salon who really has no real information, just heard that this is possible and is just starting to explore. I just kind of want to define what some of the available treatments are, and maybe kind of talk a little bit about, what they can do and what they can't do. But before we get into the specifics, I want to talk about the preventive. The young girls are talking about how Botox and fillers can be used to prevent aging. So will you either confirm that fact or bust that myth for me? Is Botox and fillers a preventive treatment for aging skin?
So yeah, absolutely. So I'm going to confirm that fact, and I'm going to confirm it to a certain extent.
Yeah.
So, especially Botox, if we take away the movement of like the upper third of the face, and when I do the preventive Botox, I kind of call it baby Botox because I use much lesser doses. If you never make the lines by never having the movement, you'll never get the wrinkle. So absolutely, preventative Botox is the thing. But that doesn't mean that if you wait until you have the line, it still works really, really, really well.
Yeah.
So, it is a thing. It definitely works. I do think what's much more important though, and I have an episode on that, is sort of like establishing good habits early. So I think what works also amazingly well is if you use good products from the beginning, if you clean your skin regularly, if you don't sleep with your makeup, no matter how long you were out clubbing, we all know this, that we've all done this.
Yeah.
And, if you wear sunscreen every day. So all those things are super preventative too. If you never smoke, if you drink lots of water, have a healthy diet, get lots of sleep, all of that stuff. But yes, preventative Botox is a thing.
So you see how genuine, how ethical this physician is. She's basically telling you folks who are listening that she wants you to not need her. She wants you to do all of the right things so that you don't ever develop wrinkles where you need injectable procedures, which means she would be out of business. You would be out of business if everybody did all those things and didn't smoke and drank enough water and wore sunscreen. Inevitably, people are going to have wrinkles, and that's why.
Right. It's a fact of life.
Yeah,
People will need me just a little later in life.
But I think it's wonderful that you really focus on prevention, because not only, can that delay how long it is until you need interventions, but also it can minimize what you need, so if you practice good skin hygiene, good skin care, and good whole body health, you may develop milder wrinkles or less deep facial lines, and therefore you may need less product, less frequently.
Yeah, and we all know that old lady in Florida that's smoking her Virginia Slims, that has that wrinkled, leathery kind of skin, who does all the wrong things. Like, don't be her, okay? Don't be her. Just don't be her.
So we started talking about preventive Botox, and let's just start with Botox, because I think that's probably the most popular. It's probably
it's the most, it's the biggest, most common thing I do in my practice for sure.
So what age do you start injecting? There's probably a huge ethical component as to who you see and agree to treat as a patient, because there probably are some barriers. But generally, what age do you treat?
Yeah, so I want to say the average woman that I treat kind of starts in her 30s. I would say, it is getting, with the rise of the internet and everybody watching themselves on Zoom and Reels, I definitely, get some women in their 20s. And then, to be fair though, everybody's skin genetically is different too. I have very thin white European skin. And so I did wrinkle probably earlier, and I had a lot of sun exposure as a kid. So probably in the early 30s, and then it goes up from there. When we talk about Botox, I want you to think about Botox really as being mainly for the upper third of the face. So the most commonly used areas that we do Botox for are sort of the 11s, the frown lines or the glabella. Technically, one of my patients calls it her angry husband line, which is one of my favorite lines ever. you know and then of course the forehead lines, crow's feet. Those are the three most commonly used areas where we inject Botox, and Botox really relaxes your muscles so that you don't make the wrinkles as you do your facial expression. It does take a couple days to set in, and then on average it lasts about 3 to 4 months, but again, it can be shorter or longer, first of all, depending on dose used, and then also depending on your biology and physiology, how fast you break it down. And then also what your threshold is for the touch up. Because, like you said, I have some people coming into my office that as soon as there's any movement, they're like, oh, I need more Botox. And then I liken it a lot to like your hair, like depending on how much root grow out, you're fine with, like, nothing bad happens if you don't inject, you just get the wrinkles back. I personally don't mind movement in my forehead. I just start re-injecting myself once those lines come back sort of statically, as long as they're all smooth. When I don't make a face, I'm good. But then as soon as they kind of creep in,
Right.
I touch it up. But some of it has to do with patient preference. But on average, about every 3 to 4 months, as you can imagine, the younger patients, it lasts a lot longer. And funnily, in the very old patients, it lasts a lot longer. I think it's in those middle-aged patients that still have an active metabolism, but yet they have enough movement to make wrinkles that it lasts the shortest. But yeah, Botox, super popular if it's done well, like it's magic. Nobody doesn't like Botox. At least I have not found anybody yet that doesn't love well done Botox.
Yeah. And I think, I think it's important too, when you're talking about expectations and the importance of the individualized consultation. Some people will want you to address the crow's feet only, because of their budget, or because they don't want to use too much or whatever. But what you have to realize as a patient is that you really have to take into consideration the anatomy and the function, how the facial muscles work. You can't just paralyze one part of the face, and then expect the other parts to respond as well. So you have to treat kind of the whole region, in order to get the effect that you're looking for.
Yeah, and for every region of the face, let's say we say the forehead, if you have a very expressive forehead, you're going to need a minimum of X number of units. It doesn't work that like I can just put half in.
Yeah.
It's sort of like a lot of medicine is weight based. It's the same thing. If you want to see something in your glabella, me using 5 units in your glabella is not going to do a thing, because
Right.
it's only going to paralyze like 2% of muscles, and that's sort
Yeah.
of essentially useless.
What is the youngest? We're talking about age. What's the youngest that you'll inject?
I mean, I theoretically, I will do as soon as you're an adult. I do a Botox lip flip too, which is a little bit of Botox to the upper lip that, in older people will really smooth out the lip, will take care of some of those, we call them smokers lines, but pucker lines. But even in younger patients, by sort of partially paralyzing some of the muscles that kind of pull the lip together, and especially for smiling, it will make the lip appear fuller. So I've had some patients in their early 20s that wanted a little lip flip, and I'm totally okay with that. I mean, I don't think I would do anybody younger than 18 unless there was a really like good reason for it and their parents gave them consent. For example, I have a patient with Bell's palsy who, I use Botox on to help restore symmetry in her face.
Yeah.
So I would have absolutely no problem doing that at any age, to use Botox to restore symmetry in the face. Of course, if it was a minor, we'd have to have a long discussion that's documented with the parents and get consent. But I think if I had like an 18, 19-year-old who had a Bell's palsy, which can happen at any age, where half of their face droops and they only half animated, and I could use either Botox or filler to kind of restore symmetry, I don't think there would be an age limit.
Yeah, I've experienced that as well. And it's actually really rewarding. And that, again, just highlights the point. If you know someone if your practitioner is someone who knows how the medicine works, where it can and can't be injected, and has an eye for how it could be helpful, there are a lot of other uses for it. I had a patient who had a nerve injury in the lower part of her face from a dental procedure when she was younger. She was a teenager, and so she had a facial asymmetry, which was mild. And so we just paralyzed the other side of her face to make it symmetric. It wasn't the top, but we weren't trying to treat wrinkles, but her parents were okay with it. It was greatly going to increase her self-confidence if her mouth wasn't asymmetric. And we injected it into one of the depressor muscles of the lower face to prevent that side of the face from lifting up. And so it essentially dropped her lip some on one side, but what it did was make it symmetric with the other side.
Yeah, and I just did a young girl who had autoimmune mediated like hyperhidrosis of only one side of her armpit, after like a transverse myelitis. And, again, she was fairly young, but she was just sweating excessively on that one side only because of a nerve injury. And, you help those patients' confidence immensely, regardless of the age, because I get it. It's embarrassing. You work with people and suddenly you have this like sweat stained shirt all day long.
Yeah. Yeah, there are definitely other uses for some of these, things from an aesthetic perspective, but you certainly want somebody who knows how the medicine works, where, if you inject medicine like a filler into a blood vessel of the face, we can create one of those complications that we talked about. And we'll discuss more of that when we get to fillers, but you need to know where to put it, where you can put it, how to inject it, on what angle, which muscles to inject it into, how to avoid the major muscles of the face so you don't cause an injury. These are all things to consider when you're talking about putting a needle in your face. Or really,
the merger of art and science. It's really what it is.
It's beautiful. It's beautiful.
Mm-hmm.
We were talking about Botox. Oh, and I just wanted to kind of say, we say the word paralyze and we kind of throw that word around, but can you just tell the people who are listening what Botox is and what we mean when we say paralyze?
Yeah, what we mean is really we block a neurotransmitter from being released or uptaken. So, as we know, neurotransmitter, in this case, acetylcholine, got released by nerve endings to create synapses, which are to kind of have the muscles communicate with one another. And that's how movement happens. So what we do is we temporarily block the release of one of those neurotransmitters, which kind of weakens those muscles and doesn't allow them to contract. So when we say paralyzed, we don't really mean forever paralyzed. We kind of just use that term and we throw it around loosely. I'm glad you brought it up. When we really kind of block a neurotransmitter getting released from a synapse, and then it weakens the contraction of the muscle to give us the desired effect. And like you said, we don't want to paralyze things we don't want to paralyze, which is why we use very precisely placed, very precisely kind of chosen doses that get put right where we need it to get us the desired effect.
Yeah. And we're talking, this is botulinum toxin, which can be in the wrong hands, in the wrong form, can be deadly. So it's really important that, again, when you're preparing the Botox, you're preparing it to the proper dilution, that you're using precisely the amount. I used to tell patients, I'm putting this in particular places for a reason, and I'm diluting it to the appropriate dose, because if it's too dilute, for example, if I'm trying to get more Botox out of each vial by diluting it with a little bit more, not only is the effect going to be less, but there's a greater chance that because it's more dilute, that it will spread to other areas of the face, and not stay precisely in that muscle where I place it with my needle. And so, if the toxin spreads to other muscles that are nearby, you may get an undesirable effect. You may get an eyelid droop, or have other muscles that you don't want to be paralyzed. And so again, just continue to highlight the importance of having somebody who really, really knows what they're doing. Let's talk about aftercare instructions for Botox, because I know that there are several things that once you have your Botox, we're going to wait 5 to 7 days to really start to see it take its full effect. But there are some things that we should avoid doing after we get our Botox, and even some things we should avoid doing prior to getting Botox. Can you just give us a little bit of those instructions?
Yeah, I think a lot of the old time stuff has really been proven not to be as important as we thought it was. So the biggest thing is to be honest with your practitioner about any medications you're on. So, of course, I will inject people on a blood thinner and all that. You might just get a little bit of bruising, but bruises are temporary. But after, really, especially for forehead Botox, I tell people like no tight hats or headbands, because again, it's kind of sits there and gets taken up by the muscle where we injected it. So we don't want pressure external to kind of put it somewhere else. Same, no like vigorous massage, no home like micro whatever device that people do, like, no rolling, no like whatever. So I tell them really just like you can wash your face and all that stuff. Most of us do say no exercise for about 24 hours. And again, because vasodilation can cause a spread. But other than that, I mean, I think Botox is pretty safe, pretty good. And I do ask them for anything more invasive, like having a facial with lymphatic drainage or massage or microneedling or anything like that, to give it like a good, week to two. Again, until Botox has really settled and has been taken up by the synapses, and really just to make sure, like you said, that it doesn't spread and go places where we don't want it to go.
Everyone, I think, has heard of the eyebrow or the eyelid droop, and that's kind of like the most feared complication. Like you said, Botox is temporary. It does wear off after 3 to 4 months, but once it's in there, it's in there. And
yeah, there's no reversal for it. I mean, we really just manage the symptoms at that point.
Yeah. So just can you kind of explain how that eyelid droop happens and what the best way to avoid that is?
I mean, again, it has to do really with injection technique, where, when we inject, especially somebody's frown or glabella, first of all, like you said, to use proper dilution and always use the manufacturer's dilution, because that's really how they studied the effectiveness and the side effects. But then also, most of us got trained to stay a little bit above the orbital rim, again, so that we don't get the dilution into the muscles that we don't want. Once in a while, I mean, it happens. I'm going to say this here. I thankfully have never caused a bad one. And sometimes, people's anatomy is a little funky. The other thing is we do ask people not to lay down for 4 hours, and it's the same thing, so that you don't roll onto like one side of your face and like put a lot of pressure on it. Again, there's safe injection techniques based on anatomy that's well studied. And again, studying somebody's individual anatomy, and once in a while being like, ooh, your thing pulls really low, when you frown, let me make sure to like not hit that. But really, complications unfortunately do happen. Anybody who injects enough is going to have a complication. And the two things is, first of all, you want somebody who has either an accepted rate of complication or lower. Like, I mean, I have injected tens of thousands of patients, and thank God, and we're going to knock on wood, I have never, caused a true eyelid droop. Again, it's going to happen at some point, right? Like, just because it does, if you inject millions of people, like statistically it will. But then also that people know kind of what to look for, and also are careful, and sometimes I will inject people a little high just for that reason, because I see how sunken they are or how much that muscle contracts, and I'll tell them, I'll be like, look, I'm staying a little high on you. If you need to come back in 2 weeks and we do a little bit more of a touch up, we will do that, but that's a lot easier than having your eyelid droop.
Yeah. Yeah, I would even have gone a step further, and because I'm a stomach sleeper, so I would always tell people not to sleep on their stomach, because if the pressure from the weight of your head on the pillow, immediately after for that first 24 hours. But yeah, I mean, the complications definitely do happen. It is important to know that it does wear off. It is temporary and it will wear off. And in some cases, even if there is something that droops, you can address the other eye to kind of make it look less dramatic, but you'll notice that over time it does dissipate. And the importance of having that follow-up is also really important, because each person does respond differently. And so if you see, because we take notes for everything that we do, right? So where you put this medicine and how much you put in. So if you see the next time the patient comes back, or they show you photos of their response, and you see that either it wasn't significant enough or that it caused their entire forehead to drop more than they would like, you can adjust your dose. You can adjust where you place the medicine. You can maybe use a little bit less. And so that follow-up piece, how each person tolerates and responds to the medication, is really important for, going forward. Because like I said, it's not just one size fits all.
And I am very available to my patients, I'm sure, as you are. I have a business cell phone and everybody has my number. I mean, nobody abuses it, which is really good, but I always tell them, if you have any questions or concerns, like, reach out. Like, this
Yeah.
is why you have my business cell phone number.
Yeah,
Is because I want to hear from you, whether it worked or not, whether you have any questions or concerns, because I always want to make people feel supportive, and it's the best medical care, right?
Yeah. And you don't want somebody having a concern that could be something that could be a true complication.
Right.
And, reaching a voicemail, or, so the fact they have access to you for concerns regarding complications, and they're informed about what could potentially happen. Everyone signs consent, and hopefully everyone reads it. I know that there's, some procedures and some, things we discuss risks and benefits. But this is a situation where you really do want to go through what you're signing, so that you know what could potentially happen, the instructions, the aftercare instructions, so that you know how to avoid anything that you can avoid, and really become educated about these kinds of procedures. It's your face, you want to really take care of it. And if you have a skilled injector and you do your part, you can get really, really beautiful outcomes.
Mm. Yeah, Botox is life-changing.
And it's a gateway to other things, because
it's a gateway drug for sure.
To fillers. So let's just talk about fillers for a second. They're probably the next most popular. They are hyaluronic acid, which is a protein.
Most of them, not all of them.
So the ones that I trained on and that I use, I don't do injectable medicine anymore. So I'm not up to date as up to date as I used to be. But I recall that they're mostly derived from the combs of rooster feathers. And it's hyaluronic acid is a protein that we have in our joints. It's in our knees and in our, joint spaces that kind of.
Yeah. So nowadays they're lab manufactured. Like, they don't go killing chickens anymore.
We like to think everything is natural. I say, oh, Botox is natural. Sure, it's natural. So tell me about fillers. Tell me, what is their utility, and what someone can expect if they're looking to get fillers.
Yeah, so fillers are really for volume loss. So when we think about fillers, and yes, most of them are made from hyaluronic acid, and I do have a whole episode of my podcast of this, just kind of plug it a little bit. But if somebody is really fascinated by these topics, a lot of my early episodes are very much on what I call bread and butter aesthetic medicine. So there is an episode on Botox. There's an episode on dermal fillers. So if you want to get more into the nitty gritty, it's definitely the kind of stuff that I address in my podcast. But fillers are really for volume loss. So when we think about the aging face, like, we know that when I look at my daughter, she has this beautiful like S curve to the side of her face where, she has those beautiful cheeks and then it goes down. And so, as we age, we first lose like the pre-zygomatic or the cheek kind of fat pad. That tends to be the first thing that goes. Then we start getting a little bit more of the under eye sunkenness. We have already talked about the nasolabial folds, or how they're called marionette lines. We obviously know the enhancement of lips. But then there's a lot of other places we can put fillers. We can put fillers in temples if you look very like hollow and kind of like Skeletor like. We can enhance male chins and jaw lines to kind of give you a more, I don't know, what is supposed to be masculine look. So there's a lot of places we can put fillers, but when people think about fillers, I really want them to think about areas, not where we want to paralyze, but where we really have volume loss or those deep wrinkles that we want to fill. And like you said earlier, sometimes filler is almost like a downstream effect. So if somebody comes to me and says, I really don't like my marionette lines, a lot of times the reason is because their cheek pad has sunk and everything kind of falling is what really causes them to be very prominent. And most of the time I kind of show them like, look, the cheeks are like the trusses of your face. They lift everything up. So in order to first address these, we got to address your cheeks also to restore that beautiful kind of Y-shaped face that we think about as youthful versus when we age and the jowls drop, we get more of like a square face. And so, yeah, fillers are volume loss. What's the fun thing about fillers is that because we inject the gel or the substance, it's this instant, I hold up the mirror after I'm done and everybody's like, woohoo, yay. So it is very satisfying because it's instant. Big side effects from fillers, of course, we already talked about that the most dreaded ones are getting what we call an intravascular occlusion, where the filler gets injected into a vessel by accident and clogs up the vessel and then leads to ischemia or a necrosis, meaning like cell death and lack of blood flow distally. Again, the way to mitigate that is really to have an injector that knows their anatomy, right? And inject safely. Sometimes we use blunt cannulas and what I call sort of like high danger zones, where instead of using a sharp needle, we use a cannula. There's injection techniques like we go in deep, we aspirate to make sure we're not in a vessel. We kind of inject and leave a trail behind as we pull out because we know where we've been versus advancing the filler forward. We inject right on the periosteum because we know that the vessels lie in more superficial planes. So again, there's a lot of techniques, and I think fillers as a whole are much more technical. The risks are higher, kind of the stakes get higher. I mean, the results are beautiful. Again, they're very well tolerated. They're done really often. I love doing filler. Of course, I said before, I do a lot of lips. I do a lot of cheeks too, but lips are a little bit what I've become known for. And so we all know what lip filler does, right? Like lips, I always say we build over time, one syringe at a time to give you a great result. We let it settle. There's really nothing to love not about filler, except for once in a while I do have to tell people to stop because they get so like obsessed with it.
Yeah, I mean, you can create the look of, the look of a facelift with a combination of Botox and fillers. But like you mentioned earlier, not every product is the same. They're not made of the same substance. And there are different consistencies of fillers for different parts of the face.
Yes.
Right. So the filler that's going to lift and enhance the cheekbones is going to be a firmer, more dense.
High G prime, we call it.
Say that word again, please.
High G prime. Like G prime is the lift of filler. So something that's very like stiff and like, because we want it to enhance bone, just like you said.
Right. And if you're going to try to go after those very fine lines of the lip, you're going to use a more hydrophilic, something that is more spreadable and kind of less stiff, that is malleable. You can manipulate.
More elastic. We kind of measure fillers and elasticity too. So G prime on one axis and elasticity. So how stiff and thick is it versus how flexible and, like you said, thin and spreadable it is. So absolutely different areas of the face need different fillers, which is why I have a whole like big cabinet full of all sorts of tools to choose from.
All the different types. Are there any kind of aftercare instructions related to fillers, or are they similar to the Botox instructions?
Well, I think the biggest thing is that people can ice, people can use arnica. You are sometimes going to get some bruising and swelling with filler. Sometimes I tell people to massage a certain way if they feel little lumps and bumps, but I'm very specific with that. Most of the time they don't have to. I don't really have like an exercise restriction for filler or a don't sleep restriction for filler. But for most fillers, interestingly enough, your body integrates it with new collagen. So we do have about 4 weeks until before we want to do any kind of other somewhat deeper procedures. So no lasers, no hydrofacials, no anything like that, because we do want to give it time to have your body weave the collagen through, have your body fully integrate the filler, and then you can go on with all of your other procedures. And then also realize that filler settles, because like you said, filler is hydrophilic, meaning it attracts water. A lot of fillers are also mixed with lidocaine. So sometimes, there's all these memes out there of my lip journey filler. It's kind of on day 2, you wake up and it's a little swollen and you're like, oh my God. And then by day kind of 7, it looks like it's going to look.
It's funny because a lot of people would tell me, I loved the way they looked the second day, when they're super swollen, and then they kind of got disappointed as it settled in, the swelling went down, and then that's a kind of a good gauge. So you would like to have, if you think
another syringe, yeah.
How long do fillers typically last, and are they reversible?
Yeah, so number one, they are reversible. Great question. We have hyaluronidase for the hyaluronic acid fillers that kind of eats it away, which is really great. And whoever does fillers on you should have that in hand in good quantities. So, if an inclusion can be recognized right away, the filler can be dissolved, or if you don't love your desired outcome, or if it's, it turns out lumpy and bumpy or whatever, a lot of times, not a lot of times, but in some instances, I've had people come to me being like, I had my lips done elsewhere and I don't really like them. And I, dissolve filler that has migrated or filler that doesn't look the greatest. And so that is the nice thing, that we can dissolve it. At least hyaluronic acid, we can. All the others are a little harder to dissolve. Yeah, so that's how long do they last? It really depends on the filler. As you can imagine, the thicker fillers get broken down slower by the body. So for the thicker hyaluronic acid fillers, we do say about 12 to 18 months. The thinner fillers last less long. We're talking more about 6 to 12 months. But then again, it depends on where in the body it's placed too, because let's say the under eyes, there's not a lot of shearing forces. So even though the filler itself gets broken down slower, it kind of just sits there. So most people do get more than a year out of it. And again, it depends on, on histology, we've now seen that traces of fillers are actually there for years and years and years. The key is just, when has it gone down enough that you visually want more? So when we talk about those time frames, it doesn't mean that after then there's no filler left. What it means is the average person says, wow, I feel like the result has gone down a little bit, so I want to touch up on that mark.
Gotcha. Does the sun have any effect on how quickly products like Botox and dermal fillers are absorbed by the body?
That's an interesting question. And I don't think so. But I'm going to bounce that question back to you. Did you do any research that I didn't know about? I don't think the sun has an effect on it. It has a lot of effects on aging, but I don't think that it really breaks down stuff under your skin.
Yeah, I was just wondering if some of the variation in, or if you could potentially extend the life of your filler, by wearing sunscreen.
What I've seen is that, people that have low body fat and are big worker outers, as you can imagine, their metabolism gets turned over. So I have a couple long distance runners, and it seems that because they have very little body fat and they turn over stuff, that filler lasts a little less long in them. Again, that's just anecdotally, but it kind of makes sense if you are in a high metabolism state, and then also probably have very little body fat to start out with.
Yeah, no, that's a great point. I have another question about fillers that I wanted to ask. It'll come to me. I forgot what it was. There was one other procedure that I want to talk about, because a lot of people are concerned about, excess fat under their neck. And so the one brand name I know is Kybella, but I believe they're like lipid dissolvers. I don't recall the class of medication, but Kybella is the one that I'm thinking of, that dissolves fat underneath the jawline.
Yeah. So, I got trained in them, but full disclosure, I don't currently carry it in my practice. They had a big back order for a while, and then I just kind of started using other methods. But really what Kybella will do, or similar generic products is really kind of dissolve pockets of fat. One of the issues with it is that it doesn't tighten skin.
Mm,
So I've had a couple people that have had Kybella done that were kind of unhappy with the fact that what they actually wanted was that whole complex to be tighter
yeah.
versus just the pocket of fat to be dissolved. So, what I do is I do Profound, which is a long range RF microneedling. The only one on the market that goes pretty deep, and it is used for both cellulite and fat destruction and skin tightening. So
Okay.
we do that with really good results on the lower face and neck. And it's interestingly because I've actually done a couple of people that had done Kybella elsewhere. And I think that's, as I said, I'm not the world's biggest expert on Kybella. I got trained in it, but currently don't use it. I probably will start again. It is really good for people that literally only want to disappear the pocket of fat. What I've just found is that most people want to disappear the pocket of fat and have the tightening at the same time.
Yeah.
That's what people need to know about Kybella, is that it will make the fat go away, but that's kind of all it will do.
And tighten the skin. I remembered what I wanted to ask you about filler. I'm someone who's prone to fever sores. And so I know that,
Pre-treatment with Valtrex, yes. So important in your consult to let people know. So we do pre-treat for a couple of days with a antiviral medicine that's really well tolerated, just to make sure to not cause you a big outbreak.
and that's just prior to lip filler.
Yep. We do it prior to lip filler and certain other procedures that really cause inflammation in the skin and kind of break the surface of the skin. So I will do it too for RF microneedling. I will do it for frax. I will do it for our new device, Tixel, which is a fractional laser, because again, we penetrate the skin and it's all of the kind of stress on the body and the inflammation that really causes the outbreak.
Yeah. I think the kind of other categories of procedures that are out there, kind of, and correct me if I'm wrong, chemical peels, laser treatments, hair removal, ultrasound.
We do them all. We do them all.
And in combination, like we were saying earlier, you can get some pretty dang good results, depending on your budget, depending on your desired effect, depending on how early you start and how well you take care of your skin. These can all be used in combination to get you your desired look. Ultimately, going back to what we were talking about in the beginning, though, the goal here is for you to augment your natural beauty and to really truly feel like you're presenting the best version of yourself to the world.
Yeah. Absolutely. Just be your best you. I think that's what we all kind of want, and really in this whole theme of uplifting each other. And I love my patients. I mean, it's so fun to be part of their lives and see them over the years and sharing their special moments and really have them be in love with themselves and kind of looking away also that they probably sometimes didn't think was possible.
Yeah. And it's a great point that you bring up that we didn't touch on, that will be my last question. How far in advance of a special event should someone?
Oh, yes. I have told the story on my own podcast, but I literally had somebody make an appointment once and she wanted lip filler and she was telling me during the consult, and thank God for a consult, that this was prior to her daughter's wedding. And I was like, oh, that's amazing. Like, where's the wedding? Blah, blah, blah. And I'm like, and when's the wedding? She's like, oh, tomorrow. And this was a Friday. And I was like, tomorrow? Like tomorrow? And I was like, how long have you planned this wedding? She's like, oh, 2 years. So, the day before and I did not do her lip filler. I was like, you're going to hate me because it will swell and bruise. I'm like, you have a makeup artist, like have them work their magic and then come see me. So there is definitely a timeline. Again, on the procedure, it depends how long. And we actually have some bundles too that we've done for brides and for special events where we've bundled some of the procedures. I've done some Instagram posts about like the timeline. The best thing to do is to have a consult as early as the event is going to be and ask for your specific procedure. A filler is normally at least like a month out. Botox, if you want it to be fresh and popping, I want you to give me a little bit more than 2 weeks. I want you to give me about 2 weeks in a month, but certain other procedures are also done in series. So to get the best effect from an IPL, you do want to have 3 of them a month apart. So you should probably start 3 to 6 months out. If we're talking about RF microneedling, it tightens over time. So your max results will be at the 6 to 9 months mark. So not that you don't see results before, but it's a really great point that you bring up that number one, the day before, unless it's a facial, is probably never the right time. But different procedures do, or like we said, if you want to get filler done on a laser, there's a sequence to how we ideally would do it. Like I would probably do your laser first and then do the filler. If I really did the filler first, like we said, we'd have to wait a month to do the laser. So it's when you have something big coming up, it's definitely good to consult early and make kind of like a game plan and probably start some good skincare at the same time and get yourself all going. But that's a great point that you're making.
Overall, the importance of having a relationship, developing a relationship with your injector. You shouldn't have like a one and done kind of relationship. This should be something where it's an ongoing conversation, an ongoing evaluation, reassessment, and discussion about what your goals are and what the plan is. One question to backtrack that I will attach to our conversation about Botox. Is Botox safe in breastfeeding mothers? Because I know a lot of women delay it during pregnancy, and then as soon as that kid comes out, they're like, okay, when can I come in?
Yeah, so this is really an individualized conversation. So there have not been any studies on breastfeeding mothers. However, it's generally believed that the Botox molecule is too big to cross into breast milk. So again, there's a risk benefit. It also has to do with how old your child is, how much do they still feed, are you willing to pump and dump? So I normally ask people to get permission from either their OB or their lactation consultant who will do it. But it's a long discussion. It obviously will never be studied. Pregnancy is definitely a no-no. I'm going to be honest that I do it with a long disclaimer in breastfeeding women simply because of the science of it not crossing into the breast milk. And there's case report of women getting actual botulism and still feeding their babies without adverse results. But it has to be a long discussion of all of the factors involved.
Just being fully educated, fully transparent about the possibilities.
Yeah.
I adore your approach. I think you are brilliant. I think you're beautiful. And I love that you are so passionate about all aspects of your career and that you contribute so fully to both the patients who need you, the lives of the patients who need you in life and death situations, and that you get to experience this really happy side of medicine that's very rewarding and fulfilling and life altering, for many of your patients. So I'm so glad that you're here and that you do what you do. I'm so glad that you're only an hour from me because
you're going to have to come down.
A friend and a client in me for life, girl.
Yeah, I love it.
I know that you have your podcast, and I would love for you to tell the people who are listening where they can find you on Instagram, find your podcast, so they can continue to learn from you, and where your office is so that they can visit you in person if they choose.
Yeah, so my physical location is in Fayetteville, North Carolina. It's called Concierge Medical Arts, and the website for it, I'm sure it's going to be in your show notes, is www.conciergemedicalarts.com. My podcast is called The Aesthetic Doctor, and it is available on all major outlets. So whether you like Spotify, iHeartRadio, Google Podcasts, YouTube, Apple Podcasts, it's there. It's a little purple logo with me in a white coat. I have a Facebook page called The Aesthetic Doctor, and I am active on Instagram at Dr. Borger, and it's doctor spelled out, and then Borger, Borger. And I would love to connect with you. If your patients love this podcast and have any specific questions, I would love to answer them. I mean, this has been such a blast. I'm a huge fan of your podcast. I really love how you really address all aspects of wellness and really educate your patients on all aspects of wellness. So I'm a huge fan, and it's just been like such a pleasure and such a blast to be on your podcast. Thank you.
Oh, my pleasure. I agree. I mean, I think we're all teachers at heart, and anytime we have something that we're passionate about and educated about and experienced in, we want to share that information so that our patients get the best possible care that they can. And that's the point. That's why we do what we do. And that's why we're here educating people in our free time, so that we can have people be as safe and healthy as possible. And I think that's all any of us really ever wanted when we set out on this journey. So thank you for being here with me. I feel like we could talk forever.
I know these people are going to be like, Jesus, people, we like you, but not for 2-hour podcast.
I think there's some really great information that you shared. And I think that, it's going to be very valuable to people who are thinking about dipping their toe into the aesthetics pool. I want to connect with you again in the future. Thank you so much. Ladies and gentlemen, go find Dr. Borger online or in person. You will not be sorry.
Bye. Have a good night. Mwah.